Welcome back to Mining My Business, and this is Brother Lyles. And I want to tackle the uh, this confusing topic of the Medicaid and the government shutdown, and whether you should be worried about what's going to happen with your Medicaid and Medicare. I'm talking about this subject today because I've had some experience uh, growing up and also with my family with the Medicaid, growing up in the 70s and 80s when Medicaid, uh, I first started getting uh, generated through the black community as part of, I guess, Johnson's New Deal to help black people. I can remember my mom taking me and my brothers and sisters to the local health clinic with the Medicaid card, and I remember most of the time that we went to the clinic is mostly like if you was having asthma attacks, or maybe you cut your hand or your foot and you needed stitches or something to that degree. For the most part, back at least back at that time, we wasn't going to the doctors like that. If something could be treated with a home remedy or something, you will see where your parents would do that. But over time, as black people have utilized the Medicaid system more and more, and it seems also that sickness started becoming pervasive in the black community: diabetes, high blood pressure, cancers, all these different kinds of things. You can see that there was a greater dependence on Medicaid as our health got worse, and the poverty level in the black community, it, also started going up over the years. Now, when I got my own family, when I got out the military and I active duty military in the 1990s, and my income, even though I was working and I had a job and I had the private health insurance through the company that I worked for, I also still was me and my family was still eligible for Medicaid because of my pay scale. I wasn't making a lot, but I did carry private health insurance, and I would encourage anyone that has a job that offers you private health insurance, whether or not it's through Obamacare or not, which is a discussion for another day. I would encourage you to try to carry your own private health insurance, just because of the stuff that's going on now with the Medicaid. Well, learn how to navigate through the paperwork and the bureaucracy. Once you get that down right, and I'm talking about legal. I'm not talking about, because every application or thing that I put in for my family, it was actually needed because some of my sons were born with disabilities that they needed special care and different things that my private health insurance was not going to be able to help me pay. So the Medicaid was never our primary health care. It was like a secondary, that whatever my private health insurance didn't pay, it assisted in that, in the therapies and the different things that my children need. And so I'm not I don't denigrate anybody that has Medicaid, I would still tell you to use it wisely. And if you can get your own private, right, do that, because we already seen the direction that this administration is going. And we're going to get to that part about funding. What we want to look at is the big picture here. When the federal government shuts down, a lot of services pause. National parks, federal workers have to go to work unpaid. Programs like Medicare and Medicaid are different. They're not optional programs. They're considered mandatory spending. So this is why they're being addressed in the spending part. Now, some people are thinking that Donald Trump can eliminate Medicaid or eliminate Medicare. He cannot do that. Those are written in the law. Now, if he goes through the process, now he could try to go through the process. I doubt if he would get it done. But these are mandatory programs. What is not mandatory is an amount of money that goes into them. So in that way, he has somewhat of, control on that sense, but he does not have control over whether they exist or not. That means the money, if him and the Congress cuts it off, in a sense, the program still exists, but with less money to go around. And less money means less people can utilize it. This is the big fight, not whether they're going to keep Medicaid and Medicare. Medicare, of course, is the federal health program for older adults and people with disabilities. And as I just stated, it'll keep running during the shutdown. Your hospital visits, doctor's appointment, Part B treatments like injections, and Part D prescriptions don't stop. The only thing you might notice is some delays on the administrative side, like long waits for phone support or paperwork process. Like if you're trying to call Medicare.gov, they might have furloughed the phone workers so that you can't get through to tell them about some issues. So you might see some delays in that. And the reason I'm trying to do this is we have to be careful of not allowing the hype to freeze us up where we don't move forward to do certain things health-wise because we think all things have been cut off, and that's not the case. And what about Medicaid? Medicaid is a bit different. It's jointly run by the states and federal government, by the state. So each individual state has their own Medicaid program that they run. They run it. But the federal government has certain criteria that they give to each individual state because they're partially funding these states in their Medicaid program. States handle the day-to-day operation. The federal government, along with the state, fund the Medicaid. The federal funding is mandatory, so it's not going to be a day, unless, and again, if Trump will try to go in and change the law, there's not going to be a day that the federal government doesn't fund each individual state's Medicaid. But at what level? That's what even this fight is about. It's not that they're not going to fund it anymore. It's how much they're going to put into it. So Medicaid benefits like doctor visits, prescriptions, long-term care, they're going to keep going even in a shutdown. But if it's limited funding, that individual state now has lesser funds to enroll certain people in it. But again, if the shutdown drags on, states might face delays in approvals or new program funding. And I think this is and whether or not you for illegal immigration or not, I think this is one of the key reasons that the Republican Congress is not saying I'm in agreement with what they're doing now or not. I'm not saying either way. You determine that on your own. But this is one of the reasons why they're saying that they want to cut back some funding to the states, is because some states that are sanctuary states are taking the funding that the federal government sends to them to fund the their Medicaid programs, to also sign up people that are in this country illegally. And this is not new. This has been, and in fact, I believe this is. I'm gonna get on my soapbox on this one right here. Back in the 80s, and I this on my ministry channel, contending for the faith, before I came with created this channel. On some of my videos on my ministry channel, I would talk about this, that when I grew up in the 70s and 80s, black people were still we were still engaged in the agriculture sector. I can remember in the summertime, me and my brothers going to work into tobacco fields. It was not unusual to see black people working on farms in the 70s and 80s, up into the 80s. But somewhere in the 80s, it started dropping off. Black people started dropping off as they got opportunities to get into corporate and different things like that. They started drifting away from the agriculture, because even up into the 70s, there were still black people that were sharecropping here in North Carolina. In this area where I live at, there were black people that were still sharecropping. Yes, and I've talked to many black people, but around the time of the mid to late 80s, things started to change. You started getting the you had the Cuban boat lift, where Cuba sent a lot of people off the island into America as refugees, and a lot of those people that came from Cuba worked in the agriculture sector when they was in Cuba. Also, for whatever reason, you had always had migrant workers, I guess, coming from Mexico, that were working in agriculture in California and in the West. But for whatever reason, I had to do a little bit more studying about it. For some reason, now you had the influx of the Cuban boat people and increased immigration of Hispanics into America. Now you see where you had now migrant workers coming in and working the tobacco fields and different things like that. I can remember the first time I seen it in the late 80s, not late 80s, in the mid 80s. It was a Cuban family that they had this one particular house. They were migrant workers that came now during the tobacco, and they wasn't bringing us out there anymore. They was getting these Cubans who, because tobacco industry is big in Cuba, so they brought a lot of those Cuban migrant workers here to North Carolina to work the tobacco fields. But the thing was, after the tobacco season was over, they would drift on somewhere other place. But over time, the white farmers found it was more cost effective to try to keep these workers around, because first of all, you know that they're gonna basically take whatever you're gonna get. Not to say that when me and my brothers were working the tobacco that we was getting paid a ton of money. We wasn't getting paid a ton of money. We knew, hey, this is just a summer job. We trying to make some quick cash, get out here, do whatever we're gonna do. But whatever, for whatever reason, as the tide turned, and I believe this was probably a program they had already instituted into their mind, that this is what we're gonna do. We're gonna replace all the remaining, if there's any remaining black farm workers, we don't need them anymore. We're going to basically slave labor with these migrant farm workers, basically locked in to this. And but the trade-off is, if they stay here, we know they're going to be here illegally. We're not going to report them to the federal government, but they also, because they are giving us wealth and different things, somehow we're going to persuade the state governments to allow them, because they have this thing called emergency Medicaid, where if it don't matter, okay, let's just say, let me give you an instance. Let's just say you on a road trip, right, from wherever state you, let's just say Wyoming. That's saying you're in Wyoming, you want to travel to Indiana. Well, when you on that road trip to Indiana, when you come into, let's say you're going through Illinois, you're almost into Indiana, but you have a really bad car wreck, right? You have a really bad car wreck. You and your wife and kids, y'all all end up in the hospital, but everything that you had on that road trip, your wallet, your luggage, everything is burned up because a car accident towed the car out, and you just got out with the shirt on your back. So you don't have no money, you don't have anything, you don't have no health coverage, anything like that. So what that hospital will do, they will call the local Medicaid office and give you what's called emergency Medicaid, that will cover the bills for you and your family while you're in there. You'll get emergency food stamps, all of that to pay, because it's an emergency. It was something unexpected. What these migrants did, they was getting emergency Medicaid. But what ends up happening after so many months, they reevaluate you for permanent Medicaid, right? And so what ended up happening was some of these people ended up getting Medicaid and didn't have anything to do with their status, and that was the trade-off. The trade-off is we got all these farm workers, and then when the construction industry started kicking off in the 80s, and they also interjected the Hispanics into that. That was the trade-off. That's why when Reagan came in and they was trying to basically get Reagan to do the same thing that Trump is doing, right? Because even then you can start seeing the numbers when Reagan got in office of Hispanics, not just because of the Cuban boat lift, but also because of all the banana wars and stuff that was going on in Central America and Ecuador and all these different places. You had all these little wars that was going on. A lot of those people were influxing here into America because of the destabilization that was being done in their countries, right? Because of the drug wars and all that stuff, they were influxing into this country. So the trade-off, right, was we got to put them on the Medicaid rolls. That's why they had what they call the Great Compromise by Reagan, because there was now becoming a large segment of them that were coming into this country, and some of the Republicans back then at that time had wanted Reagan to deport some of these people. But what they did, they had what was called the Great Compromise, where Reagan made a pathway to citizen. He said, I'm not going to give you citizenship, but I'm going to make a pathway. And they said the pathway to citizenship program that he made, eventually a lot of those immigrants took advantage of it, and about 3 point something million of them became American citizens through his pathway, and the fix has been in since that they would get the Medicaid as a trade-off, whether or not they were legal or illegal. I can remember when I got out the active duty military and I came back to North Carolina. This was in the mid to late 90s, and one of the jobs that I was working, it was a Hispanic guy, and basically he just boldly basically told me, "Hey, I'm here in this country illegally." He told me, "Hey, look, I bought Social Security card, a number for $5,000. He said, my girlfriend, we're not married. He said, but she's on Medicaid for all our children," because he had children by her, but he wasn't married because he said he had a family back in Mexico that he was also taking care of. But he said his family here, his girlfriend here, she was on Medicaid. And I said, I'm thinking all these people are illegal. How is all this stuff going on? But it was a great trade-off. And so it had the Medicaid rolls over the years have ballooned to this, and then in the last couple of years that Biden was in, and they basically opened the floodgates and let a lot of them flood in. A lot of states have put these people on the rolls, and now they were looking to the federal government to increase the funding for their state Medicaid programs. And some of the Republicans, and this is the irony of it, because a lot of these farmers and a lot of these businesses that were benefiting from the illegal immigration also was, I said, put the fix in that they would turn a blind eye to these people getting on the Medicaid rolls. They are also Republicans. So it's kind of like a double-edged sword. They like the low wages that they pay these people, and in some cases, slave labor, where some migrant workers are basically, they were holding over their head. You here illegally, we'll call ICE on you if you don't continue to work for the slave labor that we have. So it's almost been like they want to have their cake and eat it too. That they say, yes, we know they're here illegally and all these things, but now we want to try to cut or eliminate them off of the rolls of the benefits, because now those in Washington are saying we starting to feel the pinch of this increased funding, even though it's benefiting some of these businessmen and women that are Republicans. So it's been a double-edged sword. So this is why we coming into this situation in the last couple of years that they've been fighting over funding for Medicaid. And I guess Trump and the Republicans is basically saying, we putting our foot down, we ain't funding it no more, and to that levels that you want, and we're gonna force these states, especially states like California and other places that have, New York, that have large illegal immigrant populations, to either they're gonna take the funding that we give them and help the legal citizens of their state, or they're gonna help the migrant. We're gonna put basically the ball back into their court, and it's gonna be up to the states to do with the money what's right. And so that's kind of what I'm seeing. That's kind of what from what I've seen, I believe was what's been going on with this this Medicaid fight. Okay, so my takeaway on this. So here's the bottom line. If you're on Medicare or Medicaid, your coverage isn't going away because of a shutdown. Your doctor's appointments, prescriptions, and treatments should continue as usual. The real impact shows up in the background in slower customer service, delayed policy changes, or state level administrative hiccups. The care itself isn't going to stop unless you don't meet the criteria. And that is the key. That is the key. They're not going away, right? But for some people, and this is going to be put in the lap of the states, right? With the Medicaid programs. You know, they gonna they have this thing called the means test, right? Where how much income you make, are you a citizen, all these different things, right? Like that, right? On what you get. Now again, it's gonna be up to the states on what they're gonna do with the Medicaid, right? Program. Are they gonna say, look, citizens first, whatever's left, if it's enough left for some of these immigrants that we know, the ones that's left now, because Trump is going after them to get them out of here anyway. But for those that still left around that might be on it, we might have to cut them and say, look, citizens of whatever state you are first, you can get emergency care or something like that. But as for now, of course, you still have Catholic charities. Here lately in the South, I've been seeing a lot of Hispanics that have been part of Jehovah's Witness churches. So you still have church agencies and things that run little side clinics themselves that can still give some of these immigrants care too. So it's a whole strategy behind this thing. What's going on? It has to do with business. It has to do with a lot of stuff. But I would say I don't think no matter what that you're going to see into immigrants, no matter how much they cut the Medicaid budget. I don't think you're going to see an end to them getting care in this country, or even some of them getting care through the state Medicaid programs, just because their lobby have become so strong, right? They have, just look at the state of Minnesota, what just recently happened in the state, city, I think the city of Minneapolis, if I'm mistaken, that they got their first Somali. It's either St. Paul or Minneapolis. I can't remember which one have got their first Somali mayor, and it's either mayor or state. I can't remember, but basically, this guy, he was a CEO of a company that was helping Somali migrants to get the homes through some program that the state of Minnesota had to help them become first-time home buyers. So no matter what, I don't think it's going to stop the migrant population, Hispanic or otherwise, from getting. There's going to be less, of course, but again, like I said, there are alternatives that they can go to. I've seen it here in my home state where they have clinics, dental offices and stuff that are kind of like charities. That, of course, they have to wait in long lines, but they are getting care. Basically, almost like the model that I grew up in. When I was growing up in the Medicaid, my mom took us to these local clinic, the health clinic, right? And you had to wait in long lines and stuff. The same thing, but of course, the thing is, the budget battle right now. How long is it gonna last, and who's gonna be affected by it? Only time will tell. As far as the legal citizens of this country. So government shutdowns are stressful, but when it comes to healthcare, Medicare and Medicaid, they are built to keep running no matter what. I want to thank you for listening, and remember, if you want peace of mind about your own coverage, call your doctor's office or your state Medicaid office and see how things look locally. And say don't let it freeze you up. Don't let it cause you to not want to go to the doctor or whatever if you own it. And also, if you have recently lost your job, you American citizen, and you know that your income is not where you can afford even the Obamacare, because the health exchanges, we might do a video on it one day. When you go, a lot of times when you go apply for to the health changes and apply for it, if your income is a certain level, the Obamacare marketplace is gonna put Medicaid at the top of the list of affordable health care plans that you can get anyway. So I would encourage all of you that think that you can get your state Medicaid, even if you have private health insurance. I would encourage you to still apply for it, because you never know. So with that, I'm gonna thank you for watching this video. I'm gonna ask you to please give it a thumbs up, leave a comment, share, and subscribe. Bye.